Welcome to Olympian Water Testing, giving you the best in water testing and analysis. Today we're looking at ATS-DR, Agency for Toxic Substances and Disease Registry. What are the physiological effects of arsenic exposure? We're going to find out, because if arsenic gets in your water or in your food, it can have some bad effects. So arsenic targets widely dispersed enzyme systems, and arsenic affects nearly all organ systems. The most sensitive endpoint from arsenic exposure is dermal effects, and while several studies may identify effects on other endpoints at the same exposure level that produces dermal effects, the database for dermal effects is stronger than the effects for the endpoints. So, what are some physiological effects from arsenic exposure? They are patchy skin, hyperpigmentation, small follicle keratosis, and other skin lesions are commonly effects of heavy chronic exposure. It's also difficult to establish strong associations between arsenic exposure and disease, as the prevalence and spectrum of disease linked to chronic arsenic exposure differ not only between countries, but even within countries. Arsenic can cause lung and skin cancers and may even cause other cancers, and the association between chronic arsenic exposure and cancer is strongest for skin, lung, and bladder cancer. Liver, angiosarcoma, kidney, and other cancers have limited strength of association. And also to note that when the strength of the association, and that's defined as the magnitude of relative risk in the exposed group within that control group, is mentioned, it's one of the different 5 criteria. So we can see some clinical presentation: anorexia, brown pigmentation, peripheral neuritis, muscular weakness, pain, paralysis in extremities, hepatic lesions, localized edema, fatty degeneration of the heart. There's also gastrointestinal and hepatic effects, GL effects seen acutely after arsenic ingestion, less often than inhalation or dermal absorption. Fundamental GI lesions appear to increase permeability of small blood vessels, leading to fluid loss. Extensive inflammation and necrosis of mucosa and submucosa of the stomach, intestine may occur and progress to perforation of the gut wall. A hemorrhagic gastroenteritis may develop, with bloody diarrhea as presenting effects. Arsenic intoxication may result in toxic hepatitis. Chronic arsenic ingestion may lead to carotid portal hypertension. There's a limited strength of association of chronic arsenic exposure and non-carotid portal hypertension. Also, cases report have linked chronic high-level arsenic exposure with hepatic angiosarcoma, a rare form of liver cancer. There's renal effects, such as chronic renal insufficiency from cortical necrosis. Glomerular damage can result in pornuria. Kidney is not the most sensitive target organ for chronic arsenic toxicity, as organ systems may be affected at lower doses. Cardiovascular effects, and they can vary with age, dose, and the individual, but they can also be hypotension, shock, vasodilation, and quite a lot here. There's even neurological effects such as muscle cramps, tenderness, numbness, and it keeps going on and on, where we can see dermal effects, we can see a lot of effects of arsenic, and they are quite terrifying, as well as different cancers. And if we keep going and going, we can see that there's a plethora of issues that can happen. Now, you can get exposed from arsenic to your food and also to other elements, but mostly through your groundwater. That's why it's always a good idea to periodically test your water